All right. So I'm going to call the meeting of the Monday, May 6th, 2024 Human Services meeting to order. May I have a roll call? Or a roll call for attendance.
Councilmember Herrick, can you hear me? Herrick Harris,
Here.
Councilmember Ravel. Here. Councilmember Reed,
Here.
Councilmember Burns,
Here.
Councilmember Harris.
I think Councilmember Harris may or may not be virtual, but we'll add her to the roll if she's able to attend. All right, so we have a pretty concise agenda in front of us. I'm going to make a few, or just one change, maybe two. I'm going to move HS4 up to the top, which is the review of the Evanston Police Complaints and Comments Report. May I have a motion? I'm sorry, I'm skipping public comment
hear if you're speaking.
and all kinds of things. It's not usually my
Councilmember Reed,
MO.
we can't hear you.
Councilmember Harris is on.
Oh, okay. Councilmember Harris is here and is present
There we go.
and
Thank
added
you.
to the roll. All right. With that, may I actually have a motion to approve the minutes?
So moved.
Moved by
Second.
Councilmember Burns, seconded
Second.
by Councilmember Harris. All those in favor, say aye.
Recording
Aye.
in progress.
All those opposed, say no. Any abstentions? The ayes have it, and the minutes are approved. That brings us to public comment, of which I don't know if we have any. Oh, we have two folks signed up for public comment. So we'll start. Indona, you're walking up to the mic, so if you're signed up, feel free to come up.
Hello, my name is Indona Mubuai, and I'm here for public comment. I'm here as an advocate of Cradle to Career and also a community member, and I'm here in support of, I'm sorry? Could you repeat the name of the
The Pathways to Wellness.
Pathways to Wellness? And I'm saying it as someone who does have a chronic disease. And just the fact that a number of people in the Black community and community of color have chronic diseases that often go overlooked and under-researched. And I just want to say that I'm definitely in support of the proposal.
Thank you, Indona. Next is Ms. Holmes Ross. No worries.
Good afternoon, Council.
Good afternoon.
I'm Kimberly Holmes Ross. I'm Executive Director of Evanston Cradle to Career and Second Ward community member. I am in full support of the Pathways to Wellness program. I think it's an amazing collaborative effort where many organizations will have the opportunity to participate. So I'm hoping we get a strong yes on the Pathways program.
Thank you. Is there anyone who would like to give public comment but did not sign up? You may approach the microphone. And I'm sorry, I think I saw one hand on the other side as well. Oh, okay. There is. Okay, I see you online as well. We'll go to you next.
Good evening. My name is Tracy Brown Powell. I'm a fifth generation Fifth Ward resident, and I am in full support of the wellness program. I'm also a participant of the program. I too had questions in the beginning, like why such an expensive program? But to be honest, you can't put money on health, and especially the disparities that are going on in the Black neighborhood and Fifth Ward. And as a resident, as a community member, I also work at Evanston Township High School. There's no dollar amount that you can put on health. Thank you.
Thank you. All right, I think I saw another hand in the room, and then we'll go to the one person online.
Hi,
Hi, good evening. My name is Deanna Gibson. I am here on behalf of for Pathways to Wellness. I am in agreement that this should be passed. As Tracy, I echo Tracy. I am a product of one of the programs already that is being run by Natisha, and is needed for our community in order to educate not only the African Americans but everyone that lives within the community. We want to have long generational wealth and health, and I believe that this particular program is necessary for it to happen, and not just as a pilot program for the city of Evanston, but I see it not just for us here, but also branching out to other communities and other states. So I believe I vote yes, and I hope that you all do too. Thank you.
Thank you very much. We have two folks who also signed up online to speak either in person or online. One is Linnea Latimer. The other, are you online? Nope. Okay, and the other is Susan Laws, I believe. Susan? All right, and if you're not online, then we will go to the person with their hand raised online.
Thank you. Is that me?
Oh, I'm sorry. I thought it was you, but I can't see.
I tried to follow protocol. I couldn't find the link, so I apologize. Thank you for accepting my public comment. I first want to start with thank
1
you
second,
to-
Council or Alderman.
Uh-oh, can
It's
you
hard
hear
to
me?
hear you in the room. I don't know if that's on your end or our
Can you
end.
hear me better now?
No, but I think maybe our. Nope, there's nothing on our end. All right, so we'll just.
I can hear on this side.
It's hard to hear you as well, but go ahead.
I wanted to thank you for taking my public comment. I wanted to thank Natisha for bringing forth this proposal, for her visionary leadership and her commitment to wellness in the community, specifically in the Fifth Ward. I'm in full support of the Pathways to Wellness program. I hope that it is supported, fully funded. I could speak to being a past Fifth Ward alderman and hearing from the community, seeing their needs, understanding the life expectancy gap and all of the health disparities that were highlighted even more so during the pandemic. Her program is very well thought out, supported, founded, and I believe that the work that she's been doing already in the community to support health is evidence of how excellent and committed the program would be going forward. And I'll also like to add that when we heard from the community in 2019 on the ways that we would like to see our Black community repaired, health, wellness overall were a top priority. So this also satisfies some of the work and the demands that came from the Black community all the way back in 2019. And so I just want to offer my support and gratitude as a Fifth Ward resident, a product of the Fifth Ward, and hope to be a beneficiary of the program. Thank you.
Thank you. Is there anyone else online or in person? If not, then we will close public comment. Thank you, everyone, for participating. That now brings us to our agenda. And if we can move item 6, HS4, the review of the Evanston Police complaints and comments report. May I have a motion? I move.
It's really hard to hear you all. It's muffled.
Yeah, I think we're both experiencing the. Anderson's out there. I think he's working on it. Give us 2 seconds. I will speak now and see if anything's changed. Councilmember Harris.
What'd you say? I hear you speak. I just can't.
I guess not. That answers itself.
No.
I heard that. It answers.
Are other folks online able to hear us in the room?
Is
Yes.
it specific mics? Can you all hear me okay online?
Yeah, we can hear you. So it may be Councilmember Harris. There may be something on your end. Anderson says it's.
I doubt it, but okay.
Okay.
I need to be able to hear because I vote. So I want to be really clear about that. Thank you.
I didn't hear what you said. I wish I understood. You weren't clear then.
See, I just said it's important that I hear because I'm
Yes.
a voting member, not just
Yes.
Thank you. I hear you. So we'll keep going, and when I can't hear, I will let you guys know. Thank you.
Do you want to try to log off and log in again and see if that helps at all? I don't know.
Okay.
Okay, so we'll continue on. Sir?
Thank you for having me, Chair, committee members, and staff. I'm Aaron Warnick. I'm a
Oh,
grant-
my apologies. 1 second. Was there a motion and a second? I don't recall if someone moved it.
So moved.
Moved by Councilmember Burns, seconded by Councilmember Hedikadis. Sorry.
Thank you, and thank you for putting me to the front. I appreciate it. Aaron Warnick, Evanston Police Department Office of Professional Standards. Today we have 1 complaint and 9 compliments. Just asking that you accept and place our report on file. And if you have any questions, I can answer them for you.
Thank you. Seeing no questions, all those in favor of accepting and placing on file the review of the Evanston Police Complaints and Comments Report?
Aye.
All those in favor say aye. All those opposed say no. Any abstentions? The ayes have it. Thank you, sir.
Thank you.
All right, so that brings us back to our original order. And so may I have a motion for HS1?
So moved.
Moved by the Evanston Pathways to Wellness Program, moved by Councilmember Burns, seconded by
I'll second that.
seconded by Councilmember Hedikadis. Is there any discussion? Councilmember Burns.
Yeah, I was just sitting here trying to figure out how long we've been discussing this, because I've been saying a year, Natisha, and it's actually been, I see in my email, we started talking about this in August of 2022.
Yes, sir.
And we started meeting on a bi-weekly basis December 2022, and that meeting included Director Ogbo, who was here with us. It included very early on Director Flax. Later on, we kind of looped Councilmember Hedikadis in, although the time didn't work well with his schedule, but he stayed in the loop with me. It included a Cradle to Career at one point, and so I think it would be difficult for anyone to find an initiative that has that we've taken as much time with on developing. And if you were able to read the updated memo that's in everyone's packet, I think that's well reflected in the information we've provided. And so Natisha is here, and I'll allow her to give everyone an update on the work we've been doing since the last meeting. We received questions from Councilmember Ravel, questions from Councilmember Harris that we've responded to them directly. And I think they'll also notice that their questions, we've incorporated their responses and how we've, those responses are also reflected in the memo as well. That's in everyone's packet. And, but we have some exciting developments and updates to let folks know about. So Natisha, if you will, and then we'll open it up for questions.
For sure. Thank you so much, Councilman. To the committee, thank you for having us and hearing us for action tonight. I greet you with great appreciation, really believing in this program. So I am Natisha Blunt Waldron. I live here in the Evanston community and have for over 15 years now. All of my children were born here in this community. I work here. I serve here. I am a wife, a mother, healthcare administrator for over 15 years, a published author, fitness instructor, and entrepreneur. I have gotten together in response to the E-Plan results that the whole community was appalled about, knowing and awareness of how it has impacted our community. And so I today greet you with my esteemed colleagues, which are online. They are composed of 2 clinical nurses, 1 DOE and LPN, both who own and operate agencies that serve underserved communities. We have 4 certified fitness instructors. 2 of them are medical billing specialists and have a significant amount of years in the healthcare system as well. We have a certified nutritionist and a clinical master's in social work that is also serving on my team. We have partnered with Dr. Kang online. She is the founder of Kangaroo Health. And what she has done is designed a program that suits to and not a new concept, but remote patient monitoring. And what remote patient monitoring does is it is responsible for monitoring, tracking, and trending people with chronic illnesses. We know that the purpose of this program is to track chronic illnesses, and that's what we are doing comprehensively. So we shared in the memo, hopefully you have had an opportunity to review it, but some of the changes that we have made are in response to some of the concerns that we have. What makes this program unique is it is considerate of social determinants of health. It considers the lack of nutrition amongst communities that have a higher prevalence of chronic illness. It considers the lack of resources that are available to focus on health outside of basic day-to-day tasks. It considers the lack of resources here in the Evanston community. And so for that, we have studied and provided community partnerships and connections that are considered with the concern about how much it costs to run the program. And so what we've done is we have added a research component to the program that will not only serve this program over the next year instead of 2 years. We have the ability to obtain the results that we need in 1 year to minimize our costs, our output. Secondarily, we have also decided to partner with Sarah Welch, who is the Director of Research at Northwestern University. And what she will be doing is overseeing the investigative work of the program. And what we will do is we will offer a comparative study. 150 participants will participate in a blind study over 1 year. What will happen is they will all be enrolled over a 60-day enrollment period, and it will be based on the results of a data-driven survey that they will complete in form of an application. After the application process is completed, half of the participants will receive remote patient monitoring and a food stipend. The other half of the participants will receive remote patient monitoring, a food stipend, fitness 4 days a week, nutrition classes, and other wraparound services to support them here in the community. And this is in response to what we know is missing from the community. And so what we have the ability to do now is compare the effectiveness of the work that we're doing. Remote patient monitoring is not a new concept. It is successful around the country. There are a higher prevalence of compliance with primary care results, compliance with preventative health care and testing, compliance with medication and resources. And so we know that that increases above 80% when people are on remote patient monitoring. What remote patient monitoring lacks, however, is community. There is some data that shows that over a period of time, when individuals are not supported with coaching, with community, that prevalence of compliance does decrease. And so what we're doing is we are adding those missing community methods and interventions to the control group. So what the program is designed to do is, one, utilize remote patient monitoring technology, deepen or develop primary care relationships with the doctor. And we intend to do this by offering a partnership with Erie Health, and they have agreed to inherit the portion of the population that do not have primary care relationships. We intend to address healthy food insecurities with a monthly stipend to help participants purchase healthy food, and partnership with restaurants and grocery stores here in the Evanston community that are willing to offer healthy food alternatives. We intend to address medication negligence by offering patients reminders and ensuring that they have advocacy with medication through the weekend, reducing their visits to the emergency room. We offer appointment reminders and advocacy for preventative care and daily biometric readings. As we know, there is a lack of trust between the Black community, the Hispanic community, and the healthcare system. And so what we will be doing in this program is assisting people with advocating for themselves in the health system as opposed to avoiding it. They will have access to low to no cost remote and in-person fitness classes. We will be providing re-education courses for meal prep, disease management, mental health, and wellness, as well as other literacies. The platform has the ability to collect and track several data points. Our focus initially was diabetes, high blood pressure, asthma, and what am I missing?
Obesity?
Obesity. All right. So what we have done is we have refined our focal points to just obesity, diabetes, and high blood pressure. These conditions are usually diagnosed in a coupled circumstance or dual diagnosis. And so our focal point is to highlight or track A1C levels, the blood glucose, as well as, of course, weight, BMI, and overall wellness. We have also decided to reduce the focus of mental health, mental wellness from the program because there are other programs and resources in the city that have been funded for that. So our ultimate goal is to show that this program will reduce the overall life expectancy gap that we have now existing of 13 years in Evanston. And so our proud partnerships with several communities here in Evanston, several profound organizations is what we believe will kind of help to close that gap. And so what I would like to do at this time is pause for any questions, and then I can address any questions that the council members have outside of what we turned in.
Thank you.
And just quickly before we do that, do we want to introduce Sarah Welch, allow her an opportunity to?
Yes, I do have Sarah Welch. Sarah, I think you'll do a better job of introducing yourself than I would.
I am here. Sorry, I can hear everyone, but not super great. Can people hear me or no?
Yes, we can hear you.
Okay, great. Yes, I am here. Sorry, was there a question for me or you were just introducing
Just
me?
asking if you can introduce yourself and talk about your specialty in research.
Oh, yes, certainly. I can do that. Oh, never mind. You can't see my face. Okay. So my name is Sarah Welch. I am the director of research evaluation in the Buehler Center for Health Policy and Economics. We're located in the medical school at Northwestern. So I am located on the Chicago campus, but obviously we are part of Northwestern and care very deeply about Evanston as well. So I have, in my career, worked on a lot of program evaluation projects as well as research projects looking at public health and health services initiatives to improve health around Chicagoland. I have worked with a lot of initiatives that are looking at these sort of systems and environmental barriers to healthy living. So a lot of work around concepts that were brought up this evening, food insecurity or food access issues, other types of access issues around accessing health and wellness activities and options there. And then let's see, I'm trying to think of what else. So I also have spent a lot of my career partnering with community organizations. So I do work on funded, research projects through the National Institutes of Health, but I work on the whole range of efforts, and I also work on sort of smaller scale issues and really partnering in meaningful ways with community organizations, working to improve, neighborhood by neighborhood health and wellness of their residents, as well as I've worked with. Sorry.
Oh.
Was I being played off?
No. We fixed hopefully the audio issue, both for you and hopefully for you and certainly in the room.
I don't want to upset anybody, but I could barely hear most of that. And this is actually a very important component of what we're trying to do here. And so it may be in an abbreviated fashion, if you wouldn't mind,
Sure.
Sarah, repeating some of that. Sorry about that.
No, that's no problem. Great. Well, now I had my practice run, so I can be more efficient when I tell you all about myself now. So my name is Sarah Welch. I am a researcher and an evaluator in the Buehler Center for Health Policy and Economics in Feinberg School of Medicine at Northwestern. I have been working as a public health and health services researcher and evaluator for about 15 years. And most of that time has been spent sort of split 50-50 between working on sort of somewhat research projects, and then the other half on program and initiative evaluation, partnering with community organizations throughout Chicagoland. So really focusing on the work that they're doing in, from small scale, one neighborhood to working with like the Cook County Department of Public Health for suburban Cook County, Chicago Department of Health. So I have a lot of experience working on different scope impact from, very hyper local to sort of a city or county wide. And all of my work has focused on health and wellness, public health. Specifically, I spent many years working for Lurie Children's on childhood obesity prevention efforts, and those were mostly focused around the sort of policy systems and environment change that's necessary, not only on individual behavior change. So sort of the acknowledging that individual behavior change doesn't happen in a vacuum, and that individuals are impacted by what they have access to. So food insecurity, food access issues are a major limiting factor that need to be addressed. So I know that those have been brought up earlier this evening, but that type of idea is really important for these types of efforts because it's not just an individual making a choice, absent the rest of everything that's going on. So that would be my short speech about who I am and sort of some of the relevant work that I've done and the experience that I have around evaluating this type of an effort, both sort of topic-wise with health and wellness, as well as sort of scope-wise on a county or city level.
Thank you.
Thank you.
And then, was there someone else, or are we good to move forward?
In addition to Sarah Welch, we have Dr. Kang on, who we heard from at the last meeting. She is the designer of the remote patient monitoring platform. Additionally, we have Nurse Kim, Doctor of Education. She is an implementation specialist for remote patient monitoring programs. Kim and I actually worked together for Cook County Health, responsible for Kim, 5,000 patients over a 3-year period for remote patient monitoring. So if you guys have any questions for either of them, they would be considered experts in this matter. Feel free to ask. If not, I'll speak to our advisory board that is also composed of 7 MDs, right? We have a lot of doctors who have come forth from North Shore University Health Systems here in the community in support of this, inclusive of Dr. Fisher, which is the Director of Research here at North Shore University Health Systems. So we have vetted this program from top to bottom for nearly 2 years now, and I hope we get your yes today.
Thank you. Councilmember Burns, anything else?
I want to. Does anybody have any questions? Or we good?
I do. Councilmember.
I guess just right before then, I just want to make sure that Sarah has an opportunity, because this is also what I'm excited about, is how we can, quite literally extend people's lives and allow them more time with their families and to be here with us. But also that we're the exciting part about adding the research component is the opportunity to add to the body of work, the medical work around these types of interventions. And Sarah, if you could, before we open up for comment, just talk about how would we be adding to that body of work, and who might be interested in sustaining this work beyond this pilot program if we were to be successful?
Yep, I'd be happy to. So the evaluation that we've been planning has two components. So the type of evaluation that many people will be familiar with, an outcome evaluation, looks at whether you're achieving sort of the health and wellness goals that we have set for this project. So that is one piece, and I will talk about that as well. But what I think is also important about what we're planning is that we're going to be doing a process evaluation as well. And what that means is that we are going to be reflexively looking at what we are doing, the services we're delivering, how they're being received, and both what the people who are involved, so all of the partners as the project team members, how the running of the program is working. And the reason this is important is because we need to know sort of when you all are thinking about whether this is something that should be sustained, and as we look at our outcomes in the context of what was the effort that it took to achieve those outcomes, having the process evaluation is really important. So we're going to be collecting information about what we're doing, how we're doing it, and how it's going in real time. And then as we learn from that, if there's anything that we learn that needs to be, sort of tweaked, or we change this, or we add a session, or whatever the case may be, that gets folded in sort of immediately in real time to improve the program as it's going. And so it's sort of a learning and a course correction if needed. Then on the outcome side, because we know exactly what we did and how we did it, our outcomes have a lot more meaning as well, because we know how we got to them and we know what got us to them. So for the outcomes, we are looking at, I'm so sorry. I'm sorry.
Blood glucose.
Health clinical outcomes.
Okay.
I'm so sorry. I lost the word. Apologies. So looking at clinical outcomes.
Okay.
So we think that these types of measures, that's really the benefit of having this remote patient monitoring relationship, and the ability and the functionality of remote patient monitoring is access to a lot of clinical data. And so those data are going to really inform the clinical health outcomes that are achieved through this initiative. So those are sort of one set of outcomes. But then another set is really, we're going to be collecting information about what the program means to people, and a little bit more of sort of the mental health is a clinical outcome, but sort of some of that more contextual and sort of opinion and satisfaction of the participants. And the reason that's important is because things like self-efficacy, or sort of believing that you can make positive changes in your life and then going on and doing that. So that behavior change and intent to change behavior, that those are also important. Obviously, the goal of those is to ultimately get to the clinical outcomes, but they're all steps along the process. So we will be looking at all of those. And then the last point was about who might be interested in this information. We are keeping an eye on sustainability, of course. And so thinking through collecting information in a way that we'll be able to share it with people, stakeholders who might have an interest, such as health and hospital systems, providers, and healthcare insurance company, health insurance companies. They all may be interested in sort of the clinical health outcomes, and then providers might be interested in the sort of some of those more proximate outcomes of like attitude and behavior change as well, as something that they could have conversations with their patients. And then very quickly, the last thing is informing the literature sort of in a more academic fashion. That is not, I'm sure, probably your all number one priority. That would be more around sustainability and actual like implementation and action to impact people's lives. But the literature and adding what we learn to the academic literature and the research in the field will help the entire field move forward. And then researchers can build upon that to continue learning, what works for people. And that would, of course, filter back to residents of Evanston as well, though a bit more in a slightly more delayed fashion, but not unimportant fashion.
Thank you. Anything else, Councilmember Burns?
No, that was it. I hope that got me really, excited about this. I hope we're all excited. This is real work. And honestly, I think if you look at how the ARPA program was fashioned, this was what they really wanted to see, local governments doing with these funds. And so I'm just truly excited about this. But that's all. Thank you, Chair.
Thank you, Councilmember Ravel.
Well, first, I just want to say it sounds like it's been months and months of discussion and work to get to this point, but I think the result is really reflective of all the care and thought that's gone on into the program. I'm really excited about the way it's designed and the huge evaluation component, the fact that there's a control group and then a intervention group. And I do think we're going to learn a lot. And I think that's going to be really useful, not only for Evanston, but for other communities as well. I'm glad that we could hear so much from Sarah Welch this evening. It's too bad, I guess, that City Council won't have the benefit of all this as well. But it's just been very helpful, I think, for me to hear all the information you've provided this evening. Do I have any other thoughts? Will we hear from you maybe mid-year about how things are going or something? Is there any?
Yes, absolutely. So it has been requested as part of our partnership with the City of Evanston that we provide data analysis and reports to Health and Human Services on a quarterly basis. So
great.
Absolutely.
That's great. I look forward to that.
All right. Thank you, Councilmember Ravel. I have a few questions. I must have missed the last meeting where this came to Human Services. I didn't see it in the memo. I do through conversations with Councilmember Burns. Is my recollection correct that is there a geographic area smaller than the city of Evanston that these funds are targeted to? So just the Fifth Ward again, or just the
No. So 8092 is the focal group. So the way that the what do we call application process works is people will be provided with a point system. So say, for instance, you get 1 point if you live in the city of Evanston, 1 point if you live in the Fifth Ward, 1 point if you have a chronic illness, and then 1 point if you have 2 chronic illnesses. And so if you don't live in the Fifth Ward, it'll just change the priority of your point system, but you might gather other points because you have dual chronic illnesses. So that is considered. We know that Census Tract 80, 92, 95 were impacted. I think there was one more. It's not coming to me immediately, but no, this is not closed.
Yeah, in inclusion, when you take a look at the review of the impacted areas, 8092, obviously, we have 8096, which is between Ward 5 and Ward 2. Then we have 8103, which is actually in the 8th Ward. Yeah.
So just to be clear, so 8103 is folks are getting points for being in 8103.
Well, the priority based on points on the most impacted area, which is 8092. But that doesn't mean that we will abandon or forsake other impacted areas. And the areas that I mentioned are also impacted areas, but they are not as impacted as 8092.
8092 was chosen because 1/3 of 8092 residents have been diagnosed with high blood pressure.
And
What did we say? 25%. At
and also
minimum of
just we haven't-
25%.
if we can show, I think what we're really saying is if we can show that even areas within other census tracts have a similar challenges with managing chronic illnesses, to me, I would not be concerned about adding them, to the point system. I think the reason why there's so much focus on 892 is because much of what we learned in the E-Plan focused on 8092. So anytime these type of programs come up, we have a similar conversation. We just had it with guaranteed income. The reality is, and obviously it's the unfortunate reality, is that when it comes to health and income outcomes, much of that is really focused in on one particular census tract and the entire census tract. And I think that's why, we rightfully continue to prioritize it. But I don't think there's anything stopping us from prioritizing other areas, smaller areas perhaps within other census tracts as well. So we can take a look at that take a look at the data between meetings and try to identify those areas and make sure they're included.
Yeah, thank you. I would be interested in looking at the underlying data to make sure that the South End is, chronic illnesses and, these kinds of life challenges that folks are facing don't know geographic boundaries. And I understand there may be concentration. I'd love to just look at the underlying data, but folks are in need all across the city. I want to make sure that folks have access to this regardless of where they live. I do want to stop my questions quickly because I do see that Councilmember Harris has her hand up. So, Councilmember Harris.
I'll let you finish.
Oh, okay.
We're on the same path.
And then if I can speak to that, though, I believe
ahead.
the initial proposal, which hasn't changed, was that a 75-25% ratio of the allotted slots would be designated for other areas of the city, despite the impact to 8092.
Thank you. How do folks join? So I'm hearing that, there isn't, it's not a first come, first served application. There's going to be some.
We'll have an open period and a closed period. Between that time period, people are welcome to submit their applications. The point system will be public knowledge, and when we close it, we'll take the first.
150.
Yeah, absolutely. With the goal and desire, of course, to continue the program after the 1 year.
And how, if there are 20 people who, have the same number of points and we've hit 150, is there a lottery system? How are we going to?
We'll make sure there's a lottery system so that it's equitable.
Okay. Are there age requirements?
Right now, we do not have age requirements. I think we are asking the participants to be above 18 years of age.
Okay. So just an adult. Otherwise, this is really exciting work. I'm really happy to have this before us. Thank you, Director Ogbo, Councilmember Burns, and the whole team for making this happen. As I noted, my main concern is I do want to see the program expanded out to maybe have an equal point system or a different point system for folks who are in other impacted areas. Otherwise, this is a great program. We know how important, not just increasing, sometimes we focus on increasing lifespan, but I think the term that folks are using now is not just increasing lifespan, but increasing health span, and making sure that those years, those elongated years are healthy years where folks are active and able to truly enjoy it. And so I think this will add quite a bit to the literature, as was pointed out, and I'm excited to looking forward and looking forward to that. One last thing that I'm curious about on that point is, so we're going to be tracking folks for a year. I heard you say that, we'd be tracking things like their A1C. I know that high blood pressure is one. Are we going to be tracking things like cholesterol or?
No.
Okay, just A1C. Okay.
A1C for diabetes, weight, body mass index for the weight portion.
And then for high blood pressure, I guess just your
the blood
pressure readings.
Yes.
Okay. Okay, and then okay, that's all I have for now. Are there any? Councilmember Harris.
Thank you so much, Chair. So I had a question, and I think it was new to me. I heard they get a point if they're live in Evanston, so that means outside of Evanston, people can apply for this?
No, so that was really a hypothetical. Let me explain the point system. So no, this is a Evanston-based program.
Okay, because that changed my whole vote right there.
No, ma'am.
I'm not interested at all. And it is an exciting program, and I'm very excited about the opportunities. I, too, have stood on this and will stand on it. I have community members. I used to live in the 5th Ward, so I'm always going to advocate, even though I am all of Evanston, I'm going to advocate for residents in the 2nd Ward, the 8th Ward, while they are not concentrated to the same number that our data gave us from before. There are issues and concerns that need to be addressed, and I want to make sure that we're focusing on all of those. And as with reparations, we're focusing on everyone, not just one. If you live in this pocket, right?
Absolutely.
So I always want to make sure that our tax dollars, which come from all of Evanston,
That's right.
help those that are in most need, not just pockets of it, though we know there's a higher concentration from the last census that we're coming up. I'd be interested to see if that data remains the same, but that would be the only apprehension that I've had, that I've expressed, and will continue to express on any program that is isolated. But I think I'm willing to give it a try and see what that is, what that does to this community. Does it make a difference? How it makes a difference? And we'll go from there. So
Thank you, Councilmember Harris. I did want to respond to that, if that's okay. This really, your conversation presents an opportunity. Maybe if we can sit down and discuss how we might be able to ensure that there is space and opportunity within your ward, and we'd be happy to bring portions of the program there, because one of the issues is accessibility. We would not want to hold classes solely in the 5th Ward if there is a need in your ward. And so we'll need some Park District cooperation so that we can keep down costs. We don't have to rent additional space. We'll be happy to extend the program to other areas.
That'd be great.
Thank you. Councilmember Hidekaris.
Yeah, I just wanted to thank everyone who's worked on this. You can tell there's a lot of care that's gone into the program. I think as a whole, our nation doesn't do a great job of taking care of folks, and our healthcare system needs a lot of work. And this is, I just applaud you all for finding ways to make a difference in our community.
Thank you.
And I'm looking forward to supporting this.
Thank you so much.
Thank you, Director Ogbo.
Just one thing that Ms. Weldon mentioned is that there will be reports to the Health and Human Services Department. Not only that, the plan is to bring it forth to Human Services to provide quarterly reports so that we know the progress of the program and information that ought to be relayed to our Human Service Committee and the community at large. So I just wanted to mention that. Thank you.
All right. With that, I'll just say that as I'm going to be voting yes today, I would like to see, as Councilmember Burns noted and as Councilmember Harris raised, between now and council, just some of the underlying data that led us to pick 8092 as the census track, and see how different 8103 is from that. And if there's a way to create more parity between folks who are in 8092 and 8103. I would really appreciate that. And to have a clear understanding of the point system as we vote for this too. I think that's important.
Absolutely.
All right. With that, all those in favor say aye.
Aye.
All those, thank you. All those opposed, any abstentions? The ayes have it. And this will move forward to council at our next meeting.
I don't think it will make the May 13th.
At our
but maybe the
next
subsequent-
meeting.
Mhm.
All right. Thank you.
Thank you. I appreciate you.
All right. If we don't mind, if we can do one more jump around to an item for discussion, which is ending breed restrictions. We do have a city staff member here for this. So may I have a motion on HS3?
I will move discussion of ending breed restrictions for residential units.
Moved by Councilmember Hedekatis, seconded by Councilmember Ravel. Thank you. All right. I will open us up on this discussion. It's a pretty straightforward discussion here. It would be creating a new section of code that would ban breed restrictions for residential units. Some housing providers use breed restrictions. Some folks would say some housing providers use breed restrictions as a way to as a backdoor way to discriminate against folks, because there are certain breeds that are associated with certain communities. And also, there's just no evidence that I've seen that would lend us to breeding, to banning specific breeds rather than sizes of dogs. I think if a housing provider wants to say, I don't want a dog over, 75 pounds, that's fine. But to say, I don't want a specific kind of dog, I don't think the research backs that up. We have our animal warden with us. Do you want to introduce yourself?
Good evening, everyone. My name is Perry Kabala. I am the animal warden here at the city. I'm happy to answer any questions you guys have regarding the laws that we currently have in the city of Evanston, or any questions that I can try to get back to you on that, maybe need a little bit more research.
Yeah, I'll have just one question for now. And within your experience, is there anything that would lead you to believe that breed restrictions make sense?
As far as I've ever seen, there has never been an outcome that I think people are looking for when they put in the breed restrictions. From my understanding, it's put in and you're not necessarily seeing a decrease in dog bites or dog problems that are coming on. I think that, as you stated, the evidence shows that breed is not directly related to the behavior that a dog has. So as far as I've ever seen, it's never been correlated, and the outcomes are not necessarily what are expected.
Thank you. And then last bit on this, just as for folks as a companion to this, I've been speaking to the director and with our animal warden regarding licensing for pets, and the way that we currently, speaking directly to the issue about biting and other nuisance issues that may rise from an animal. The way our current law works is that we license the animal as if they have some, the autonomy to live up to the expectations of holding a license. But I think that we need to rewrite the law to issue the license to the person, because we know that there are folks who are just irresponsible owners, and an irresponsible owner can get 5 dogs, and each of those dogs could have behavioral issues because the owner is not properly attending to them. And so I want that on folks' minds as we're thinking about this. We'll be able to hold irresponsible owners accountable without holding the wrong party accountable by holding a dog accountable for its behavior. Is there any further discussion on this? Councilmember Hedekatis.
I just wanted some clarification, and we're just talking about dog breeds, so this
Correct.
okay, great.
Councilmember Raveau.
So are we going to the second point that you raised about licensing the owner rather than the dogs, or
That
we're
I
just
do
focusing on?
plan. Right now, it's just the breed, but I mentioned that just so if there are concerns about biting incidents or any other behavioral incidents with the animal, we're looking at changing the. I have a proposal that should be coming to Human Services in the next few months to look at licensing as well.
Okay.
So then, what I would like to see is for this to come back to Human Services as a draft ordinance. Again, I want to reiterate that folks would still be able to, housing providers would still be able to restrict based on size, just not breed. So I think that's a fair compromise. So with that, Director Oppo.
Also, upon review of our ordinance, vaccinations of animals, especially dogs and cats, is absent from our ordinance. So if possible, Councilmember Reid, if we can add that element to this proposal as well, because that's also important. We do have nearby communities where it is a requirement that upon licensing that they ensure that their pets are inoculated with the rabies prevention vaccine. So I would like for that to be incorporated in this request.
Certainly, and I think to the licensing request makes sense there. Wait for legal department.
Good evening, Chair Reid and members of the committee. I just wanted, Catherine Penrose, Law and Assistant City Attorney. I just wanted for purposes of drafting that ordinance, whether you are, if this is going to be applying to housing providers, whether that is going to be part of the landlord-tenant or housing provider-tenant ordinance, which is currently, of course, under review in Housing and Community Development Committee. If you wanted it a part of that.
I think it makes sense to go into the residential housing provider tenant ordinance. I don't think it needs to go through HCDC and through that track, but certainly it would be an amendment to that section of code. All right. With no further discussion, I will just move that we bring back an ordinance on the breed restrictions, and if folks are amenable to it, also the issue that the director raised around vaccination and licensing to our Ms. Sloan. Do you think a month or 2 months? A month?
1 month is fine.
To our July meeting of the Human Services Committee. So I will move that.
Second.
Seconded by Councilmember Burns. Any discussion on that motion? If not, all those.
Just quick discussion. I don't think this is going to become a controversial issue, but I just wanted to read something that says the American Veterinary Medical Association and the American Society for Prevention of Cruelty to Animals both argue against breed-specific legislation, advocating instead for policies that consider the individual behavior of each dog and promote responsible pet ownership. And so I'm going to vote for this. And if I am presented with any research that conflicts with this, these are experts in this field, then I will reconsider, but happy to support this. Thank you.
All right. With that, all those in favor say aye.
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 All those opposed? Any abstentions? The ayes have it. That brings us to our last item of business, which is HS2, Ordinance 30-024, amending Title II, Chapter 36 of the City Code concerning the regulation of video gaming. So moved. Seconded by Councilmember Hedekadis. All right, thank you. So I'll kick us off here. And I just want to lay the foundation for why we are here. It was brought to my attention by Rob Beatty that video gaming was a thing, and that there are businesses in Evanston that are looking to engage in video gaming. This was during our discussion where this committee and ultimately council passed sensible updates to our gambling code that align with where we are today. This part was, and so a part of that was the regulation of video gaming in the city of Evanston. That was pulled out from the original ordinance for a host of reasons. And during the time that it was pulled out, it was discovered that there is a state law that allows for the VFW or the American Legion to apply directly to the state for the video gaming license without a local ordinance authorizing it. And so since I believe they have applied for that, is that correct, Rob? They've applied and successfully applied for it. And so when we look at the new landscape for video gaming and the video gambling, really, video gaming is maybe somewhat of a misnomer, but for video gambling, for virtual gambling, folks have there's the sports betting apps that folks have on their phones. There are casino apps that folks have on their phones. Folks are finding a way to gamble today. You don't have to go to a casino. You don't have to, travel out to Rivers or Des Plaines or whatever it is in order to gamble. You can do it from home, from your computer, from your cell phone. I personally am not someone who is supportive of gambling, but under the circumstances that there is an Evanston establishment that is allowed under state law to apply, under the circumstances that, folks are gambling on their phones, whether we like it or not, I think it makes sense for us to allow for our businesses to install these video gaming machines to get some of those folks who might be gambling alone at home out of their houses and into our local businesses, in community, in a place where, they can, get some food, have a drink, and as I said, be in community. And so for those reasons, I will be voting yes to this, and I encourage folks at least to move this forward to council. I don't know if I see that we have a number of business owners here that represent various businesses in our city. And I know Rob has sent a list of businesses over to us who support it. I think that represent just about every ward in the city or very close to it. So I'll stop there and we can answer any questions that folks have or take a vote. To the Councilmember Burns.
What I will say is, I don't know how I'm going to vote on this once it gets to council. I think, but I'm someone that's been consistent in, if there's a constituency or members of our community who organize themselves, around a particular issue, and I believe it's important to allow those groups an audience with the full council and to make their case to the full corporate authority. And so for that reason, I will support advancing this to city council. Don't know ultimately how I will support it. One thing that came to mind is I don't think a less convenient way to gamble is going to lead to more gambling. To Councilmember Reed's point, if you can do it on your phone, there's nothing more convenient than that, and there is perhaps an opportunity that through the peer pressure that comes from being in an actual location and gambling, that maybe people gamble less because, when they're around others than when they're home alone. To Councilmember Reed's point, worst case scenario in a dark room, drinking and by themselves with nothing to regulate it at all. Again, not saying I'm ready to support this ultimately, but I will say I don't think this is going to lead to an increase in gambling. It's just going to give people another opportunity, a different way to gamble, and more importantly, there's just from my packet, clearly there's enough businesses in the community that are in different wards that are interested in adding this to their business. And so again, for that reason, I'm willing to allow the folks to make their case to the full council, and we'll see what happens there.
Any other comment?
Yes.
Oh, Councilmember Harris.
Yeah. I just want to say, as an addiction specialist, that isn't how addictions work. So shaming is not going to bring people into the community to gamble, does not change the addictive disease, just so we know that. While I see the businesses, I struggle with most of the businesses, I will say, are residents of the community, but not all of them. And the feedback that I've gotten from residents is, at least in the second ward, has been against at this point. So I have no issue moving it forward, but I am still conflicted with the information I'm receiving, and again, being an addictions specialist, that I do have concern with bringing this to Evanston. So I just wanted that noted, but I'll move it forward.
Thank you. Councilmember Revelle.
Excuse me. Well, since our first discussion of this issue, there's been, I think, some interesting coverage in Evanston Now. And we, Evanston Now received a letter from Ashley Humphrey back in March, reporting to us about research about basically the social costs of gambling. So she cited, in particular, research in Australia reported in the Journal of Gambling. Who knew? The electronic gambling machines that are being proposed for Evanston are more strongly associated with problem gambling than other types of gambling. The overwhelming evidence from numerous academic studies indicate that video gaming is one of the most addictive forms of gaming. And just to kind of set a different picture than I think my colleagues are setting here, every detail of the video gambling experience, from the lights and the shape of the buttons to the sound effects, has been meticulously designed to make people play longer and faster and to spend more money. Studies show the rates of gambling addiction tends to increase with the number of gambling options. And so I think adding more gambling options here in Evanston would be a big mistake. What else? Also, Evanston Now did some calculation about sort of the finances of all of this. They said this is all, based on, I think, the number of video gaming establishments we might have in the community and the number of terminals, or what, that's not quite the right word, terminals. So that wouldn't necessarily be what we end up with, but based on I think the draft ordinance, it was the city would gain about $100,000 in new income, while gamblers would lose roughly $1.5 million a year playing video gaming devices here in Evanston. I don't see that as a very good way for us to be trying to raise revenue. I think it's unfortunate the American Legion is choosing to seek a gaming license. But I think we should hold the line on expanding it further than that. So I'm a no vote right here in the council.
Thank you. If I may respond to that, and I agree. Again, it has been purported in the media as, like this is Reed's gambling business, and I saw a headline that said that this is I hate to even use this term here, but the crack cocaine of video game, or whatever it was. I couldn't even get past the headline. And I agree with you. I mean, yes, these machines have been designed to create exactly the effect that you described. But I wonder, I didn't see that research myself. I wonder how old that research is. And I have a buddy who has a gambling addiction, and he does it through his phone. And the phone does all of those same things. I hear the noise going. I'm like, oh, I know what you're doing. You're gambling again. And So it's making those noises, it's lighting up, it's doing all the same things from folks' phones. And so I'd be interested to see, and I think I think it has a similar effect. And so I don't know if that study included the new world that we're in now that is especially, boomed since the pandemic and since, more and more things have been moved virtual. I agree with you, Councilmember Harris. I agree with or I appreciate your assessment there that shame is not what is going to change folks' behavior. And that certainly was not my line. I think my line is more so just, creating an alternative. While I don't think this is going to lead to more people gambling, I don't think it's going to, I think it's really just going to create another avenue for folks to engage in behavior that they normally would engage in, and allow them, instead of engaging in it in displays or in wherever else, or from their phones, it allows them to do it here in our community, support a local business. And I'll note that, that $1.5 million is likely going to be leaving Evanston anyhow. These folks, they have an issue. They're going to be gambling. They're going to be using their phones. They're going to go to displays. They're going to go to now Bally's or whatever it is in Chicago, downtown. They're going to spend this money. And so the difference is the $1.5 million is leaving Evanston one way or another. Does the city of Evanston get a cut of it because we regulate this? And do our local businesses get to benefit from it because folks are keeping this behavior local rather than taking it elsewhere? And so I highly appreciate those concerns, and I think they are valid. But I think given the landscape, it's a battle that under our current regulations that we've lost. And I think what I'm looking to do is make the best of a not great situation. And that's what this ordinance is. Councilmember Hidekaris.
Yeah, kind of echo some of the thoughts that Councilmember Reed had. This is very much, in my estimations, money that's going to be spent whether or not it's here or in Morton Grove or, like you said, Des Plaines. We have a handful of businesses who have asked, and are interested in having this accessory gaming at their establishments. And for me, this is more of a support of our small businesses. I know margins are tight with the way the economy is, and this is, a potential extra revenue stream. The number, like 100,000 for the city, is not really why I think we should be doing this. It's not, for me, it's just the support of small businesses. And so I'm a yes now. And I very much see that, the gambling is not going anywhere. It seems like on a national scale, it's going to be expanding, and it's, unless, that changes, I think, it would be remiss to not have it happen here too. So.
Thank you. And with that, I'll just close with this unless there's anything else. Go ahead.
I just wanted to make sure my point was understood as well, is that one of the arguments that I heard even for cannabis lounges was the potential for the lounges themselves to expand that particular activity, because everything else is so restrictive, right? Like, there's really nowhere else where you can consume cannabis, and therefore, if you provide lounges, a space for it, then there's an argument to say it could expand it. I think the point I was trying to make, although again, I'm not, I can't commit now to voting for this, is that I just haven't seen anything that suggests that this will expand gambling in Evanston. That's not to say how I will end up voting for it. What you described, Councilman Ravel, is, as Councilman Reed said, is everything that you can do on your phone. And so I also want to look at the research to see when it was done, because there was a time when that might have been the only flashy thing that gave you rewards, that made sounds. But now all that is loaded, is in the palm of your hands at any given time, as long as you're connected to the internet, not even stable internet, just some internet, even internet provided by your carrier. You don't even need to be at your home connected to Wi-Fi to access those websites. And so, but that's different for the other example I gave with lounges. It is restrictive. You can't consume cannabis in every apartment building, for example, and nor can you do it outside. And so it is so limited that there's an argument to say if you provide a lounge that may expand who uses them or who consumes and ultimately uses those lounges. So I just wanted to make that clear. But again, similar to other issues, the business community has, at least a part of our community, business community, have organized themselves and have showed up to meetings to really express that they want us to consider this. And so I think it is fair to them to allow the whole council to consider it and decide how we move forward. That's all, Chair.
Thank you. And with that, Councilmember Harris, go ahead.
Yeah, I'm sorry. So I just want us to also, I totally agree that we want to at least hear our businesses out and make sure that we're supporting them. I believe we've overturned and changed legislation in Evanston showing our support in that way. But I want us to be clear, is that the Evanston we want to be? And I have no judgment in that. But is that what Evanston wants to be for the amount of money it is? And I think even maybe waiting, I know Chicago is about to, I don't even know if they opened Bally's yet. If
it's open.
Open. And say it again.
It's open. I walked past a couple days ago, maybe a week ago.
Okay, awesome. But I also want us to take into consideration, we just changed smoking or selling, flavored tobacco because of the influence that we believe it had on youth. And I think while parents are playing on their phones, children are being exposed to it a little more earlier than in previous times where that wasn't possible and gambling was really this hidden thing. I want us to have that same energy for gambling. Is that what we want in our restaurant with our kids out? Do we want them seeing that? We can't prevent what people are doing at home, but when we make these changes, we need to look at them on a lateral sense of different areas in which, if we're protecting our youth, this might be one of the ways in which we do that. So I think those are the two things we need to think about. Is that something Evanston wants to be known for? Is it worth it? And not comparing it, but putting on a lateral place of, we just got rid of flavored tobacco because it was enticing the youth. I think the gaming on the phones is enticing youth at a younger age. And the more we expose people to things, the more it becomes commonplace. So I just want us to think of those things. Thank you.
Yes, thank you. And I'll just close with this. I would support any portion of the revenue that the city is anticipating to go toward, requiring that at everywhere where these machines are, there's a sign where folks can get help for gambling addictions and, get the messages that hopefully can move them away from gambling or to a more healthy, right? Because not all gambling is like, I don't gamble. I try not to even do it at all because I don't want to get hooked to it. But, there are people who do it casually and it's not, something that ruins their lives. And so, and also, this is the first time I've heard about the concern for secondhand gambling. But I do, I hear you on that. I'd say, don't Google YouTube or social media. But so I think we have the votes to move this forward. I'm encouraging the advocates of this and the businesses to, you're hearing what the word is here, to continue to speak with folks. And I encourage my colleagues here and on council to continue to do their due diligence on this issue and to, to really put this in fair light of, what there's who we want to be and there's the world as it is. And I think if we look at the world as it is today, and try to make the best out of the world as it is today, I think folks will be able to come around reluctantly, like myself, to this item. So with no further discussion on this, all those in favor say aye. Oh, I'm sorry. Okay, roll call. Roll call was asked for. Councilmember Hericades.
Aye.
Councilmember Ravel.
No.
Councilmember Burns.
Aye.
Councilmember Harris.
Aye, to move it forward.
All right. And myself, aye. So the ayes have it on a 4-1 vote. Yes. And so with that, with no further business before us, unless there are any other items for communication from members? No? With no further business. And I also, I'm sorry, I do want to acknowledge there's one person in the audience who raised their hand. Public comment had ended. And so normally we don't take public comment during the committee discussion, but I do want to acknowledge that I saw that you had comment, and I'm happy to listen to you between now and council. But with no further business before us, I call this meeting adjourned. Thank you.